Arthritis affects over 100 conditions, impacting about 1 in 5 U.S. adults. Early diagnosis is essential to managing symptoms and preventing further progression. This video covers primary risk factors and 5 key self-care strategies. Managing arthritis effectively involves a consistent set of daily habits rather than a single solution. Based on authoritative medical guidance, we will explore 5 core strategies to reduce pain, stiffness, and flare-ups. Here is your quick takeaway. To manage your arthritis, aim to stay gently active, protect your joints from strain, manage your weight, utilize heat and cold therapy, and incorporate daily stretching into your routine. Movement is the most effective way to reduce arthritis pain. Focus on low-impact activities like walking, cycling, or water exercise. It is important to avoid high-impact activities like running or jumping that stress vulnerable joints. A simple 5-minute daily stretching routine can help keep your joints flexible. Focus on gentle motions like shoulder rolls, wrist circles, knee-to-chest stretches, ankle rotations, and neck stretches to improve your comfort. Heat and cold therapy offer instant relief. Use a heating pad for 20 minutes or a warm shower to relax tight muscles. Use an ice pack wrapped in a thin towel after activity to reduce swelling and sharp pain. Weight management is crucial. Reducing even a small amount of body weight, like 5%, can significantly lower mechanical stress on your knees and hips, which directly reduces pain and disability. Protect your joints by making small adjustments to your daily activities. Use both hands to lift objects, avoid repetitive kneeling or squatting, and utilize assistive devices like ergonomic handles to reduce strain. Don't overlook mental and emotional care. Stress and frustration can often worsen arthritis pain. Combat this with relaxation techniques such as meditation, deep breathing, expressive journaling, or simply listening to calming music. For occasional pain, over-the-counter options like acetaminophen or ibuprofen may help. However, if you find yourself relying on these frequently, it is time to schedule a visit with your doctor to adjust your treatment plan. Managing pain is more effective when you stay informed. Learn as much as you can about your specific condition, maintain a strong support network including your healthcare professionals, and always report changes in your pain levels. Here is a simple routine. Start your morning with a warm shower, gentle stretches, and a short walk. In the evening, use light stretches, heat therapy, and an ice pack if needed. Which joints bother you most? Be mindful of your posture during daily routines and know your limits to avoid overexertion. Furthermore, consider lifestyle changes such as weight management and quitting smoking, as both can significantly impact your long-term joint health. To exercise safely, focus on low-impact activities like walking or cycling that build strength without harm. Avoid high-impact exercises like running, jumping, or repetitive overhead motions that create harsh, repetitive stress on your joints. Many medicines are available to manage pain, including oral options and topical capsaicin creams. Always consult your healthcare professional to ensure your medication plan is safe, effective, and tailored to your specific symptoms. Managing chronic pain requires a strategic approach. It is vital to avoid common pitfalls like over-relying on over-the-counter medication or, conversely, ignoring persistent, severe pain that leads to joint damage. Beyond physical symptoms, arthritis affects your mental well-being. Frustration or discouragement is common, but it is important to address this emotional impact as part of a holistic care plan. If left unaddressed, the cycle of fear and anxiety can actually amplify your experience of physical pain. Do not hesitate to seek professional support if you feel overwhelmed by these emotional challenges. Disrupting this mind-body connection is key. Therapies like cognitive behavioral therapy, or CBT, help you change self-defeating thought patterns, while relaxation techniques like deep breathing can directly reduce physiological stress. Physical treatments such as acupuncture and massage can also target key points to improve joint mobility. Remember to use heat or cold packs safely to manage acute inflammation, limiting heat applications to 20 minutes. Certain habits act as significant pitfalls. Tobacco use, including e-cigarettes, can directly damage connective tissues and worsen joint degeneration. A negative mindset can also create a feedback loop that limits your mobility. Understanding the basics is your first step. This includes learning about risk factors and core self-care strategies, as well as tailoring physical activity to stay mobile while reducing overall joint pain. Different forms of arthritis, such as osteoarthritis or rheumatoid, require specialized care. Recognizing your specific type is essential for creating a targeted and effective treatment plan. There are many programs and resources available. These include community-based initiatives focused on physical activity and partnerships with national organizations that provide evidence-based solutions for managing orthopedic care. Managing symptoms offers major benefits, including reduced pain, delayed disability, and improved well-being. 5 core habits include learning self-management skills, staying active, weight management, joint protection, and early provider consultation. While there is no cure for arthritis, targeted treatments are available. These range from over-the-counter and prescription medications to specialized physical therapy, and, in some cases, surgical options recommended by a specialist. Beyond typical risks, other factors like smoking, history of joint injury, or certain infections can trigger or worsen arthritis. Even career-related factors, such as military service or labor-intensive jobs, are linked to higher risks. To help you manage symptoms at home, focus on these 5 steps. Learn self-management skills, move more, maintain a healthy weight, see your provider regularly, and always protect your joints from preventable trauma. For specific conditions like gout or rheumatoid arthritis, early clinical diagnosis by a rheumatologist is crucial. They can help you implement medication plans, manage flares, and adopt habits that protect your joints. Finally, remember that you are not alone. Access resources from the CDC and partner organizations to stay connected with the latest research, clinical guidelines, and supportive programs designed for your journey. This video highlights the core components of national arthritis initiatives. Component 1 focuses on expanding public health efforts, including increasing access to evidence-based interventions and utilizing resources like the National Arthritis Helpline. Component 2 prioritizes enhancing provider capacity. This involves developing innovative care models, increasing clinical awareness to improve patient referrals, and promoting physical activity as a fundamental, drug-free approach to managing joint pain. Thank you for joining this exploration of arthritis management strategies. We appreciate your attention and participation in this video. For more information, please visit the links provided on the screen.